In 2025, a quiet revolution is unfolding across Africa's health sector. Faced with shrinking foreign aid, rising health demands, and the lingering aftershocks of the COVID-19 pandemic, many African nations are taking bold steps to strengthen their healthcare systems from within. From record-breaking budget increases in Uganda and South Africa to innovative public-private partnerships in Kenya, Morocco, and Egypt, a new era of homegrown investment is reshaping how health is funded and delivered on the continent. This shift marks not just a response to crisis, but a strategic move towards greater health sovereignty, resilience, and long-term well-being for millions of Africans. By investing in domestic health financing, expanding universal coverage, and embracing local innovation, African nations are building systems that are not only responsive to present challenges, but also equipped to withstand future shocks. This transformation is about more than healthcare. It is about empowering communities, protecting livelihoods, and securing a healthier, more equitable future for generations to come. Join us now as we take a look at African countries investing significantly in the health sector in 2025, based on recent budget decisions and initiatives. Do not forget to get engaged in this video by liking, commenting, and sharing your thoughts in the comment section. And also subscribe to this particular channel for more interesting and exciting things coming from Africa. Uganda. The Uganda government has demonstrated a significant commitment to strengthening its health system by more than doubling its health budget for 2025-26 fiscal year. The allocation has been increased from 2.95 trillion Uganda shillings to 5.87 trillion Ugandan shillings, marking a substantial investment in the nation's health infrastructure and services. These bold moves come at a time when the country is facing decreasing donor support, highlighting the government's determination to prioritize the health and well-being of its citizens. With local health demands on the rise, this increased funding is expected to have a positive impact on the overall quality of healthcare in Uganda, enabling the government to address pressing health challenges and improve health outcomes for its population. Nigeria. In a significant show of commitment to healthcare sector, the Nigerian government has allocated an additional $200 million to its 2025 health budget in response to the suspension of the U.S. health aid. This strategic investment will prioritize critical areas such as epidemic control, vaccine procurement, and treatment programs, ensuring the continued delivery of essential health service to Nigerians. By bridging the funding gap left by the aid suspension, the government aims to maintain momentum on its efforts to combat present health challenges and improve health outcomes for its citizens. This proactive approach underscores Nigeria's dedication to self-sufficiency in healthcare financing and its determination to protect the health and well-being of its population. South Africa. The South Africa Parliament has demonstrated a strong commitment to improving the nation's health outcomes by approving an additional $1.5 billion in funding for healthcare in 2025. This significant investment will enable the country to bolster its healthcare infrastructure and services, ultimately enhancing the well-being of citizens. In addition to the increased funding, South Africa is expanding its non-communicable diseases screening programs with ambitious plans to conduct tens of millions of screening for hypertension and elevated blood sugar. This proactive approach aims to identify and manage these conditions early, reducing the risk of complications and improving health outcomes. Furthermore, the country is accelerating its human papillomavirus HPV vaccination campaigns, which will prevent cervical cancer and other HPV-related diseases. By prioritizing chronic disease prevention and early detection, South Africa is taking a crucial step towards reducing the burden of NCDs and promoting a healthier population. Morocco, Kenya, Egypt, and others. These countries continue to attract investment in health through government-backed initiatives, Morocco is making significant strides in healthcare sector driven by its ambitious National Health Plan 2025. The country is advancing in several key areas including health tech, where innovative technologies are being leveraged to improve healthcare delivery and outcomes. Morocco is also embracing telecom-enabled care, which enables remote consultations, monitoring and treatment, increasing access to healthcare services, particularly in rural or undeserved areas. Furthermore, the government is fostering public-private partnerships to drive growth, innovation, and efficiency in the healthcare sector. Additionally, Morocco is investing in pharmaceutical manufacturing, aiming to reduce dependence on imports and develop a robust domestic industry. By prioritizing these strategies, Morocco's National Health Plan 2025 is poised to transform the country's healthcare landscape, enhancing the quality, accessibility, and sustainability of healthcare services for its citizens. Kenya and Ghana are scaling up universal health coverage (UHC) through national health insurance schemes and infrastructure expansion, improving access and affordability for undeserved communities. Egypt is undertaking a comprehensive effort to strengthen its healthcare infrastructure, driven by a multifaceted strategy. The government is upgrading existing hospitals and clinics to enhance the quality of care while also expanding healthcare services to rural areas, where access to medical facilities is often limited. Furthermore, Egypt is positioning itself as a medical tourism hub, capitalizing on its rich history, cultural heritage, and strategic location to attract international patients. To support this growth, the country is actively seeking investment opportunities in its pharmaceutical industry, aiming to increase domestic production and reduce reliance on imports. Additionally, Egypt is exploring public-private partnerships to leverage private sector expertise, financing, and innovation in the healthcare sector. By pursuing these initiatives, Egypt is poised to improve healthcare outcomes for its citizens, while also establishing itself as a key player in the regional healthcare landscape. Rwanda, Botswana, and Cape Verde are exemplary models in domestic health financing, consistently meeting the Abuja Declaration goal of allocating at least 15% of their national budget to health. This commitment has earned them recognition as leaders in health investment on the African continent. By prioritizing health in their budgetary allocations, these countries have demonstrated a strong commitment to improving the health and well-being of their citizens. Their sustained efforts have yielded positive health outcomes, and their approaches serve as a valuable reference to other African countries seeking to strengthen their health systems and achieve better health outcomes. The Abuja Declaration, adopted in 2021, aimed to improve health outcomes in Africa by increasing domestic funding for health. Rwanda, Botswana, and Cape Verde's consistent adherence to this goal demonstrates their dedication to enhancing healthcare delivery and promoting the health and well-being of their populations. At the AU level, Rwanda's High-Level Health Center Financing Conference, Addis Ababa mid-2025, is focused on building a sustainable domestic health financing framework, with Africa's CDC leading development of actionable recommendations for governments. Additionally, in 2024, 14 African countries, including South Africa, Rwanda, Ethiopia, Senegal, Nigeria, and the Gambia, pledged over $45 million to support WHO's first investment round, bolstering the organization's capacity to support member states through regional health threats and infrastructure needs. Industry analysts like IQVIA identify significant trend across Africa in 2025. Local vaccine and drug manufacturing, Morocco's Sesnio, Rwanda's BioNTech plant, expanding PPPs and accelerating UHC programs in markets like Nigeria, Kenya, and Ghana. Global aid calls, sampled from USA and the UK, have created funding gaps and incentivized countries to boost domestic health financing, either through reallocations or supplementary national spending. Rising prevalence of non-communicable diseases means that countries like South Africa and Nigeria are investing heavily in screening and prevention programs. public-private partnerships and expansion of local pharmaceutical and vaccine production are seen as vital trend towards sustainability and resilience in health system. Finally, in 2025, Africa countries increasingly rely on domestic funding and innovative finance mechanisms to sustain and expand healthcare services. As Africa charts a new course in 2025, the growing commitment to invest in health is more than just a policy shift. It is a declaration of intent. Countries like Uganda, Nigeria, South Africa, and Rwanda are proving that sustainable healthcare is not only possible but essential for national development. By reducing reliance on foreign aid and prioritizing domestic funding, these nations are laying the foundation for resilient, inclusive, and future-ready health system. The journey is far from over, but one thing is clear: Africa is no longer waiting for help. It is taking charge of its own health destiny.